7 minutes now before 11 o'clock. Optical colonoscopies have been the so-called gold standard in years, but virtual colonoscopies are gaining in popularity as the most effective way to screen for colon cancer. Dr. Mark Klein is with Washington Radiology Associates, and he joins us live this morning with more on virtual colonoscopies to talk about this. Dr. Klein, thank you for joining us again, because you've been here before and we talked at some length about this, but we wanted to have you back to talk more. No question that colonoscopies are wonderful in saving lives, but you think the virtual colonoscopy, and this is a test done with a scanner that can look inside the body versus a doctor having to use a physical telescope, if you will, to look inside the body, does a better job of finding those lesions along the colon wall that either may develop into colon cancer or are already cancerous.
Yeah. What you first said was colonoscopy is a great test. It is. Any method that looks at the entire colon is very effective because we know screening for colon cancer works. It saves lives. So the question now becomes, what's the best way to screen for colon cancer? In an average risk person, meaning somebody who doesn't have a strong family history or have had polyps before, I do believe virtual colonoscopy is an excellent test. And the reason is because for finding the polyps we really care about, those over what we call a centimeter, 10 millimeters, it is more effective for finding those polyps, and also for the small cancers, which you certainly don't want to miss. We know now, or it looks like, that it's going to be much better. We're
looking at some video right now of what you get a chance to see, what the computer it's called computerized tomography. You get the X-rays, if you will, and then the computer puts them together so that you get this basic view inside the colon.
That's right, sure. You're looking at a small polyp there. That's actually only about 6 or 7 millimeters, so you can see how easy it is to see on the virtual colonoscopy. Imagine how much easier it is to see something that's twice the size or even more. And in fact, the video we're showing right now is going to show a colon cancer. Now, clearly we want to find polyps because they're the precursors of cancer, yes, but you certainly don't want to miss a cancer.
I want to go back to something that you said earlier, that colonoscopy, when you can see the entire colon, is so very important. Do optical colonoscopies give you that view? Are you able to see just about all the way through the tunnel that you can?
Well, it's a very good question. There are a couple of problems with optical colonoscopy. Let me just state that it's a very good test, and I'm not trying to tell anybody not to have one. The question is, for screening, what's the most optimum test? The analogy I like to use for an optical colonoscopy, the typical kind with the scope, is imagine somebody knocks on your door or your apartment and you look out the little peephole trying to figure out who it is. The other choice is you could actually open the door and step outside into the hallway. You get a much more panoramic view, as you could see on these videos, with the virtual colonoscopy.
The threshold for virtual colonoscopy has always been paying for it, because until a while ago, they weren't generally covered by insurance, but they are now. And you said earlier that they're about to make the decision for Medicare as to whether the federal funding will go for these screens.
That's correct. Some of the larger insurance companies, Cigna, United, Healthcare, already cover for screening virtual colonoscopy. And in fact, in our area, the jurisdictions of D.C., Virginia, and Maryland have passed laws that mandate most insurers to cover it. Medicare will make a decision in February. We're hopeful that they will make what I consider the correct decision to reimburse for this procedure, which is certainly very critical in the Medicare age population.
Very quickly, at what point do you start getting colonoscopy of any kind?
Generally age 50, although I will tell you statistics, 9 out of 10 people who get colon cancer are over 50. That means 1 out of 10 isn't. Certainly if you have a family history, you need to start earlier.
Dr. Mark Klein with Washington Radiology Associates. Doctor, thank you so much.
Thank you very much for inviting me.
We're going to